For the latest situation on the front lines, we're joined now by Dr. Catherine O'Neill, Chief Medical Officer at Our Lady of Lake Regional Medical Center in Baton Rouge, Louisiana, a state that has been particularly hard hit at this time. Dr. O'Neill, thanks so much for joining us tonight.
Thank you for having me.
So Louisiana is now above 2,700 cases and at least 119 people have died. What's the latest on the ground in Baton Rouge?
Our hospital is the largest hospital in the state, and we're also a trauma hospital. We're used to being very busy, but we've seen an influx since last Thursday of continued ICU needing COVID patients. Currently, we have 45 positive patients. A little over half of them are on the ventilator.
Here in New York, we have several major hospitals, and there's still a serious concern about a lack of supplies. Baton Rouge is obviously much smaller with fewer hospitals. How is your hospital doing right now in supplies, and what resources do you feel that you're in need of in particular, and are you concerned about reaching capacity?
Right. So right now our hospital is not near capacity, but what we are near capacity on are some of those things that we use for people who are on the ventilator for long periods of time, and especially those who are hypoxemic. So certain drugs we've had difficulty purchasing. We do have them, but our long-term need for them is something that we're concerned about. We have enough PPE. We've been using our PPE responsibly, knowing that so close to New Orleans that we were going to see a lot of these patients. But we do worry about the next several weeks as we continue to see that increase in patients, and making sure that our staff members have everything they need, but that we're using it responsibly.
And New Orleans is on an especially concerning curve right now at nearly 18 deaths per 100,000. Orleans Parish has the highest death rate in the country, and it's not particularly close. Do you think that Mardi Gras was a big source of infection there, and where you live as well?
I think that you can't ignore the fact that Mardi Gras happened recently. I think what you see in Seattle and other areas around the country is that we do have community spread, and depending on the community, we also have accelerators. And the timing of our increase does coincide with our Mardi Gras celebrations, which are held around the state, and then our St. Patrick's Day celebrations and those festivities. And this is a big festival time for Louisiana, and now that Governor John Bel Edwards has had our stay-at-home rule, I hope to see a decrease, but those accelerators preceded our first big influx of cases, and I have to believe that they made a difference in what we're seeing now.
How would you say that people in Louisiana are reacting to social distancing? Do you think that they're taking it seriously, and what's your message to people who may not be?
I think they're taking it seriously. I think that what we're seeing is people coming to the slow realization as it hits each community that social distancing is real, that it's not about, can I go to dinner with my family in the evenings? Can I have Sunday dinner with my family as usual? We really are needing to stay in our houses. So we've seen that realization come with the inpatient increase. And luckily, it's warm here in Louisiana. We're having a great spring, and so people are able to social distance outside and not have to congregate in their houses. But it's hard for everybody. It's hard for our community.
Thank you so much for your time, Dr. O'Neill. We really appreciate you and what you're doing in the community.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.